Good day, everyone. I am Angel Bertlin T. Campus from BSN 1-2 of Isabela State University at Tiague Main Campus. For today's video, you will be joining me in performing a return demonstration on the assessment of the head and neck of a patient. Prior to performing the procedure, be sure to perform hand hygiene such as hand washing. The rationale of it is in order to avoid transferring of harmful microorganisms to your client. Then next is to prepare the materials needed. So we have here a gloves. This is your use to protect us from the patient and protect the patient from us. Next is a pen light for adequate lighting. A small glass of water. We will be using this throughout the assessment. And a stethoscope. I also have here a metric ruler, and you can use also a tape measure. This is used to measure any lesion present in the head or the neck of the client. So the first thing we must do is to introduce ourselves to the client, identify the client, and ask how he wants to be addressed. So good day, sir. I am Angel Bertin T. Campus, your student nurse for today. So, sir, I would like to ask your name and age to make sure that I am with the right patient.
I'm Jermark G. Del Monte, 20 years old.
So, when is your birthday, sir?
February 3, 2002.
Sir, kindly check your information if those are correct.
No, that's correct.
Okay, thank you, sir. So, by the way, sir, how do you prefer me to call you?
Just call me JM.
Okay, Sir JM. So, after that, we will now explain to the client how important and how significant this assessment is to his health. Okay, Sir JM. So, I will be inspecting, palpating, and osculating your head and neck to make sure that they are in normal state and to examine if there are any presence of abnormalities to avoid further complications. So, do you have questions, sir, before I proceed?
None.
Okay. So, if none, sir, I can now continue. But if you do have questions later on, you can interrupt me and ask me throughout the assessment. Then, after that, we will ask the client about the things that we are going to do if it is okay with him and tell him that the data gathered will be confidential to each of us and to the attending physician. So, Sir JM, I will do a physical examination which includes exposing and me touching some part of your body. Would that be okay to you, sir?
Yes.
Okay. Okay, thank you, Sir JM. So please don't be bothered and rest assured that all your information and findings gathered in this assessment are completely confidential with me and to the attending physician that I'll be referring to you. Okay, sir? So now ask the patient to wear an examination gown for easily examining it. So, sir, can you please wear this examining gown?
Okay.
So, this will be for your security. Okay, thank you, sir. Next is to cover the unnecessary part using the towel or a blanket. Remember to only expose the part of the body needed for the assessment. Now, we can continue our assessment. For the first part of the assessment, we can now start the inspection to the patient. Remember that the patient should be in sitting position. Inspect the head for size, shape, and configuration. Okay, so Sir JM, I will be assessing your head's size, shape, and configuration. So by the way, sir, I will be doing this procedure only by my naked eyes. Okay, so sir, I'm just looking. So identify the size if it is too big, too small, or just appropriate to the client's body. So in the shape, it should be asymmetrical or symmetrical. And in configuration, it must be erect and is in the midline. So inspecting the size, shape, and configuration of the client's head and face will give us the idea if there is a sign of abnormalities such as the Pagan's disease, the acromegaly, and microcephaly. So as I was assessing my client, I can see that his head size are just appropriate to his body, which means that he is in normocephalic state and that his head are erect and in the midline and also symmetrical, which means these are a good signs. And next is to palpitate the head for consistency while wearing a gloves. The rationale, I should say, of this is that we are going to touch the head of the patient, so we need a protection in our hands. So, Sir JM, I am asking a permission if I could touch your head.
Okay.
Okay, thank you, Sir JM. Just give me a minute to wear my gloves. Okay, so lesion and lumps on the head may indicate recent trauma or a sign of the cancer. Okay. Okay, I think. As I am assessing, my client's hair is hard and smooth, which is a good sign. And he has no lesion or any open wounds. My client also has no parasite in his head, such as lice. Oh, but as I am still assessing, I just saw that my client has a little scar on the upper part of his body. Head, I should say. So because I saw a scar, I will be using my metric ruler to measure the size of that lesion. Sir, did you happen to remember how did this scar
I don't know.
have? Okay. So the scar is about 2 meters long. So as I was asking my client, he said that he can't even remember how did that happen or when did he got that scar. So I will just take it down notes to inform the attending physician. So now inspect for the face symmetry, features, movement, and skin condition. So Sir JM, I'll be observing your face, sir. Inspect if the face is symmetric, with a round, elongated, or a square appearance, and no abnormal measurements should be noticed. Okay, so I think his face are well shaped. So, sir, I would like you to cooperate with me with some tests. Okay, so, sir, can you raise your eyebrow, please? Okay. So, close your eyes, sir. Okay. So, tighter, sir. It looks like my client is having fun with this. Okay, sir. So, open your eyes now, sir. Okay, now, sir, can you give me a little smile? Okay, thank you, sir. So, now, sir, pout your mouth like this. No, sir. Okay. So lastly, sir, puff your cheeks. Okay. So abnormality in the symmetry, sir. Movement, expression, and skin condition may be a sign of parotid glands enlargement from absence or tumor or neurologic problems. So as I am assessing you, sir, I cannot see any abnormalities such as drooping on each side of the face, which gives you a good sign. Okay, so now after that, we can now palpitate the temporal for third temporal artery, I should say, for tenderness and elasticity. So Sir JM, could you allow me to touch your face again, sir? Okay, thank you, sir. So the temporal artery is elastic and not tender. So we should palpitate between the top of the ear and the eye. Okay. So, a temporal artery that is hard, thick, and tender but has inflammation, if seen in the temporal artery, could lead to blindness. Okay. So, sir, can you bite your teeth, please? Bite, sir. Again, sir. Okay. So, lastly, palpitate the temporomandibular joint range of motion, swelling, tenderness, or precipitation by placing the index finger over the front of each and ask the client to open the mouth as if he has a history of the frequent headache. So, to assess, um, we will be placing our index finger over the front of each ear like this. Okay? And then ask our client to open his mouth. Okay, sir. So kindly open your mouth, sir. Close, sir. Open it again, sir. Close. Okay. So limit range of motion, swelling, tenderness, or precipitation may indicate TMJ syndrome. Okay. Okay, it's okay now, sir. So, sir, did you happen to experience a frequent headache?
No.
Okay. So I was assessing you. You didn't you feel any pain while biting the teeth and opening your mouth, sir? Okay, sir. Okay, if that is so, it's a good sign. I will be taking down notes of it. Okay. So, as I was assessing my client, I didn't observe any swelling, nor tenderness. There is also an absence of precipitation of movement. So, as the clicking, as he was opening his mouth for inspection, and there is no eye socket. So now, the second part. So that is how. So that is how we perform an assessment of the patient to the head. So the second part of the assessment is the neck. So, Sir JM, we are now done in assessing the head. And as for my observation and the findings gathered, they are all in good signs. Now we will be proceeding in the neck. Do you have any question before we proceed?
No.
Okay. So if that's sir, we can now continue our assessment. So first is to inspect the neck while it is in a slightly extended position and using a pen light for position, symmetry, and presence of lumps and masses. Okay, so Sir JM, could you slightly look up into the ceiling? And I'll just feel your neck. Okay. Okay, so swelling and large muscles or nodules may indicate an enlarged thyroid, uh, inflammation of lymph nodes, or a tumor. So as I was assessing, it looks symmetric, sir, with head centered, and there is no presence of bulging masses. So now I will be inspecting the movement of thyroid and the cricoid cartilage, sir, and the thyroid glands by having you swallow a small sip of water. Okay. So I have here a glass of water. So, sir, could you please sip a small amount of water and make sure to hold it a little while inside your mouth for checking. So, okay. Just please hold it. Okay, sir. So, could you please look up a little? Okay, so go. Look down. Okay, so now, sir, can you please swallow the water? Okay. Okay, sir. So, asymmetric movement or generalized enlargement of the thyroid glands is considered abnormal, sir. But as I was assessing you, there is asymmetrical movement upward and there is no enlargement of the thyroid, which is a good sign. Meaning, sir, when you swallow your water, your thyroid move upward and then down, which is just normal. So, sir, while swallowing the water, do you feel any pain? Okay, that is great, sir. I will be taking down notes of that. So next is to inspect the cervical vertebrae by having the client flex neck. So inspect if the C7 is visible and palpate. Okay, can you look down, sir? Like that. Okay, sir. So uncontrolled neck movement may be a sign of stiff neck and often late symptoms seen in meningitis. Sir, look at the other side, sir, with slightly upward. Okay, thank you, sir. So on the other one, sir. Okay, thank you, sir. So I don't see any irregularities as I was assessing while doing it. So now, sir, we will be inspecting the neck for range of motion by having you, the client, turn chins to the right and left shoulder, touch each ear to the shoulder, touch chins to the chest, and lift chins to ceiling. So, sir, kindly look up to the ceiling, upward. Yes, sir. Sir, now down to the floor, down to the floor. Okay. So now, sir, could you see your right side, sir? And then your left side, sir? Okay. So, inspect if the neck movement is smooth and controlled with a 45-degree flexion, a 55-degree flexion, a 40 lateral degree abduction, and 70-degree rotation. So, uncontrollable neck movement may be a sign of stiff neck and often a late symptom seen in meningitis. But as I was assessing you, sir, your neck is okay. So, do you feel any tenderness or pain, sir, while doing the procedure? Okay, so, sir, I'll be taking down note of that again. Okay. So next, we will be palpitating the trachea by placing our fingers to the external notch, feeling it to each side, and palpitating the tracheal veins. So the trachea should be in the middle. So sir, I'll be observing and palpitating your trachea. Sir, can you look upward, sir? Okay. Okay. So trachea away from the midline may be pulled to affected sides and maybe a sign of large atelectasis, fibrosis, or pleura adhesions, tumor, and large thyroid lobe, pneumothorax, or with a aortic aneurysm. Okay. Sir, can you swallow, sir? Okay, sir. Sir, can you swallow again? Okay, sir. Lastly, sir. Okay. So as I was assessing you, sir, it looks like your trachea is in the middle line and your tracheal rings are functioning properly. Okay. So now palpitate that thyroid gland. So locate key landmarks with your index finger and thumb. So landmarks are positioned midline. They are from midline and obstruct because of masses or abnormal growths. So, okay, sir, can you look at this side, sir? This side. Okay, so palpitating the location of the thyroid glands may indicate abnormalities and possible abnormal conditions such as hyperthyroidism, grave disease, or endemic goiter. Sir, to the other side. Okay, thank you, sir. So as I was assessing my client, as I was assessing you, sir, it looks like your landmarks are positioned midline and there is no growth of the area, which is another good sign, sir. Okay, and lastly, we are gonna asculate the thyroid glands for roots of glands is enlarged. We will be using a the bell of the stethoscope. Sir. Okay. Okay, to the other side, sir. Okay. Okay. So now we will be palpitating the following areas. that we will be needing. So the first one is the front of the ears, or also known as the preauricular side or preauricular nodes. So this will be it. Okay, so sir, kindly open your mouth, sir. Okay, close na, sir. Okay, so next is the postauricular nodes. Okay, so now is the occipital nodes. Okay, so next will be the tonsillar nodes. Okay, the submandibular nodes. Okay, then the submental nodes. Next will be the superficial cervical nodes. So next will be the posterior cervical. Okay. The deep cervical chain nodes. And lastly is the supraclavicular nodes. Sorry, I just push it a little bit. So presence of enlargement and tenderness may signify that the client or the patient is suffering from infection, I should say, or any complications. So that is the last part of your assessment, Sir JM. It seems like there is no abnormalities, tenderness, or any enlargement in any part of your neck. So if you have any questions or clarifications, or if you feel anything regarding to your health, I will refer you to your attending physician, and he'll be in charge of anything you'll be needing to know. Okay, sir? So this assessment helps us to know further abnormalities in your head and neck, and it seems like there is none, except your scar in the upper part of your head. So I'll just inform the physician regarding this, since I've already taken down notes about it, sir. So thank you for your cooperation, sir. So that is how we perform the neck assessment of the patient. Thank you so much for watching.